Okay. Good morning to Madam. Good morning to Madam. My name is ZARIFAH WAJIHAH and this is my partner, SITI NURHIDAYAH. So, today we'll present the trends of live births and stillbirths in Malaysia from 2000 to 2023. Understanding these trends is important for monitoring population growth and maternal health. Live births show how the population is changing, while stillbirths reflect the quality of maternal and fetal health care. By studying these numbers, we can see how healthcare, demographics, and policies affect families across Malaysia. A live birth is defined as a baby born with sign of life, and a stillbirth is a fetal death at 28 weeks or more with no signs of life. The data we use comes from the Department of Statistics Malaysia, the Ministry of Health, and the Open Department of Statistics Malaysia. Now, let's look at the annual live births in Malaysia from 2000 to 2023. In 2023, Malaysia recorded approximately 450,761 live births, which is slightly higher than in 2020. In 2022, if we look back, live births were generally higher in the early 20s, often exceeding 5,000 per year. Over the past two decades, we can see a gradual decline, which reflects changes in infertility rates, delayed marriage, and family planning preference. By looking at the chart, which year do you think had the highest number of live births? So, the peak was in the early 20s, and it has slowly decreased since then. Several factors contribute to this trend. Economic changes, such as higher living costs and urbanizations, affect family decisions. More women are pursuing higher education and career, which often delays childbirth. Social factors like changing attitudes towards family size also play a role. Despite the long-term decline, the slight increase in 2023 indicates that population growth is stabilizing. Improvement in healthcare, such as better maternal services, prenatal care, and higher child survival rates, have helped maintain this stability. Overall, the live birth trends show the impact of healthcare, societal, and economic changes on population growth, and it gives policymakers important insights for planning maternal and child healthcare services. Next, my partner will continue with stillbirths workshop.
Thank you, Zarifah. Now we will look at stillbirths in Malaysia from 2000 to 2023. A stillbirth is when a baby dies at 28 weeks or later in pregnancy before birth. In 2023, Malaysia recorded about 1,597 stillbirths. Looking at the chart, we can see that the number of stillbirths has stayed mostly stable over the years, with only small increases or decreases from year to year. Although stillbirths are fewer in number compared to live births, they are still a very important public health issue. Many stillbirths can be prevented if problems during pregnancy, such as high blood pressure, diabetes, infections, or growth problems, are detected early and treated properly. Healthcare improvements over the years, like better access to prenatal care, regular checkups, and hospital services, have helped keep stillbirth numbers from rising. Some small peaks in the chart may happen when healthcare access was limited in certain regions, which shows that equal healthcare for all pregnant women is important. So, in summary, while the number of stillbirths is low, each stillbirth represents a family affected, which highlights the need for continuous support and attention to maternal health. So, when we compare live births and stillbirths, the trends are very different. Live births have gradually declined over the past 2 decades, while stillbirths have stayed mostly stable. This shows that although fewer babies are being born, healthcare has improved enough to prevent stillbirths from increasing. So, factors affecting these trends include the health of the mother, planning decisions, and access to good healthcare. For example, families today tend to have fewer children. This is because women are getting higher education and more people live in the cities, which affects birth numbers. Stillbirths occur at a rate of 4 to 5 per 1,000 births, and this shows that Malaysia has made progress in reducing stillbirths, but preventable cases still happen. This emphasizes the need to continue improving maternal health care, early detection of pregnancy risk, and access to hospitals, especially in remote areas. So, in conclusion, live births in Malaysia have slowly declined over the past 20 years, while stillbirths have remained mostly stable. These trends highlight the importance of supporting mothers and babies with good healthcare services. And regular checkups, early detection of pregnancy problems, and access to hospitals and clinics are essential to prevent stillbirths and keep babies healthy. So, understanding these trends also helps the government and health workers plan for the future, make better policies, and ensure safe outcomes for mothers and infants across the country. So overall, improving maternal health and supporting families will continue to be important for the well-being of Malaysia's population. That's all. That's all from us. Thank you for your attention.
Thank you, madam.